A coronavirus vaccine for kids as young as 5 years old could be just weeks away. The update from Pfizer comes as the American Academy of Pediatrics reports children accounted for more than a quarter of U.S. cases last week. Meanwhile, thousands of frontline workers in New York are at risk of losing their jobs because a vaccine mandate went into effect on Monday. Errol Barnett has the latest.
Important news tonight for parents. Pfizer announcing it submitted data to the FDA proving its vaccine is safe and effective in children aged 5 to 11. The company says it will make a formal request within weeks to begin administering doses. If the FDA approves, kids could get the vaccine by late October or November. Meanwhile, in the nation's largest school district, a federal judge says New York City can mandate all school employees be vaccinated or lose their job. The deadline is 5 p.m. Friday.
What do you say to teachers who will not get vaccinated?
We're here to protect your rights, but at the same time, we follow the law.
Michael Mulgrew heads the union representing nearly 200,000 current and former New York City teachers and staff.
It's the only way we can go back to doing what we wanted to do, which is to teach children who aren't full of fear and anxiety.
How many teachers drop out remains to be seen, but there are signs a similar mandate among hospital employees worked. Just a week before the deadline to get at least one dose or face termination, there were reportedly still more than 8,000 New York City hospital workers unvaccinated. By last night, that number dropped to almost half as many. Also tonight, a change of heart for a former vaccine skeptic. NBA star LeBron James saying he has now received his first vaccine dose.
After doing my research and things of that nature, I felt like it was best suited for not only me, but for my family and for my friends.
Also, a new nationwide study shows a surge in vaccine acceptance among racial and ethnic groups that lagged behind. Back in May, a far higher percentage of white Americans were vaccinated with at least one dose when compared to black or Hispanic Americans. But now, not only has the gap narrowed considerably, but Hispanics have the highest vaccination rate.
There were many reasons for this gap, including barriers to vaccine access, and some still had concerns, and those concerns were often rooted in misinformation.
Now, there remains resistance to vaccines among some New York teachers, but at least 90% of them have received their first dose. Also new Tuesday evening, United Airlines announced an update on its vaccine mandate. 99% of staff have complied, minus those with religious or medical exemptions. That final 1%, almost 600 people, Ed, will be subject to termination.
Emergency medicine physician Dr. Owais Durrani joins me now. Dr. Durrani, we just heard thousands of healthcare workers in New York are at risk of losing their jobs because of their vaccination status. You've probably been discussing this with colleagues, or maybe you've been asked by patients. What would the practical effect be of having that many healthcare workers off the job because they didn't decide to get their shots?
Yeah, I appreciate you having me tonight. You know, the effect would be horrible. Essentially, we've been short-staffed for months and months and months. We've also had staff members, doctors, techs, nurses go out sick because of COVID, and that has led to the rest of us picking up extra shifts. And so even losing one healthcare provider right now is a tough situation, but having anywhere in the hundreds or thousands would be, I can only imagine how detrimental that would be to the patients.
Yeah, could be compounding the problem and making it worse for people trying to get non-COVID related treatment. Look, a new Kaiser Family Foundation report found most unvaccinated adults view the booster shot debate as a sign that maybe the vaccines aren't as effective. What do you say to this, especially as we continue to hear experts say that the unvaccinated are the most vulnerable?
Yeah, I disagree with that. You know, I think we've had a messaging issue around this entire booster discussion. We have to decide as a society what the goal is of our kind of outlook on this public health emergency. Is it zero COVID, or is it preventing hospitalizations and deaths and making sure that our most vulnerable are protected? Now, if it's zero COVID, we're going to continue to need to get boosters every so months. I don't think that's the case. We want this to turn into an endemic versus a pandemic. And so those that are in high-risk situations like myself, who see COVID patients day after day after day, those who have weakened immune systems, the elderly, they're going to need boosters. The rest of us, we're going to be fairly protected against symptomatic disease and severe disease. And so these vaccines were designed to protect hospitalizations and severe disease. They're doing that job. We've seen that in study after study in country after country. And to those who are trying to use this booster discussion as a vaccine hesitancy argument, look at the data is what I say.
A new CDC report found local reactions like swelling or tenderness near the injection site, there we go, are more frequent after a third dose of Moderna and Pfizer's vaccines than after the second dose. We have any sense of what those reactions might look like, and are we seeing a difference in side effects with boosters compared to the initial vaccination?
Yeah, so I'd say if you're going in for your booster dose, expect to feel in the 24-hour period after getting that shot the same you did after that second shot. So it's going to be local arm soreness, maybe a low-grade fever, some fatigue, and a headache. I recently got my booster, and I felt fatigued for about 12 hours, and then the next day I was brand new and feeling normal.
Yeah, good excuse to just take a nap maybe, but still worth getting it for sure. Pfizer submitted initial trial data for the FDA to the FDA for its coronavirus vaccine in kids aged 5 to 11. This is a big group of Americans that we need to get vaccinated. What happens next in the authorization process, and what kind of timeline, as far as you know, might we be looking for approval ahead of being able to let kids get the shots?
Yeah, so this is really good news. One of the most frequent conversations I have with parents are parents that are fully vaccinated but worried that they might be an asymptomatic infection, spread that to their kids. And so this is really good news that we have initial indications that these vaccines work. I expect an emergency use authorization application imminently in the next week or so, and the FDA to take its time over the next 4 to 5 weeks to truly review the data. And I'm optimistic that by the end of October, first week of November, we should have some recommendations on these vaccines for the ages 5 to 11.
So by Thanksgiving, there may be vaccinated kids sitting there around the dinner table, fully ready to go.
Yeah, I think that's a good bet.
All right. Well, look, Doctor, we appreciate you taking the time. Dr. Owais Durrani, thank you for being with us.
Thanks for having me.